Hi, welcome everyone. Okay, this is Vijaya here. Okay, I'm supposed to introduce our speakers. Yeah. Okay. This welcome to track 2. I'm Vijaya. This track covers areas on social sciences, creative thinking, blended learning, and more. Okay, the first session is entitled Reimagining COVID-19 through Digital Learning and Innovation by Design by Ku Xiao Chen and team. Dr. Xiao Chen teaches freshman and pillar courses in science, biomedical engineering, healthcare, and design. Besides innovative teaching, she is actively developing platforms to better capture classroom feedback to improve teaching and learning at SATD. So, Xiao Chen and team will be presenting on how they used digital learning and communication tools to establish common virtual spaces, coordinated discussions, and remotely engaging participants in this event. So the session will end. I'll press a buzzer at 3:15 p.m. to give you a and then if you have any questions, post your questions on the OneNote. I'll share it over the link over the chat. Okay. So now over to presenters.
Hi everyone. Let me know if you can't hear me. Otherwise, I'm Xiao Zhen. Let me try to get this up again. Give me a second. Okay. So, yes. All right. So good to see so many familiar names and faces here. So I'm going to be kicking off this session with to share a little bit more about this event that we ran earlier this year in June. And as you can see in the program, it says Xiaojuan and team, because this event certainly could not have been run alone, and it involved many people here. So William will be presenting with me today, and Bina, who is here in this session as well, had a really huge role to play. And yeah, I'm going to get started and just share with you a little bit more about this event and what it's about. Okay. Okay, so I want to begin by talking about giving you some background as to what this event is about, why we decided to do this, and who was involved. Okay, so again, the motivation behind this event is really that as we know, the healthcare sector severely impacted by the pandemic. And many of our clinician colleagues and other healthcare workers faced daily challenges in the delivery and management of care of patients with COVID-19. Okay, at the same time, at that point, we had just come out of the circuit breaker and our students had been home for many months. So we also have students that are keen and eager to contribute to the COVID-19 crisis in some way, but unable to do so because of their limited understanding or limited access, right, to the front lines. So we thought that an ideation challenge, okay, which is some sort of an event where students would be challenged to think up innovative yet timely solutions to some of the healthcare problems encountered by the clinicians would be something that would be of value, okay, to everybody involved. So more specifically, we noted that there were actually different problems, right, encountered in pandemic. So we tried to pick out problem statements in the pre-pandemic, so the early pandemic stage, the ongoing response, which is at the peak pandemic stage, and of course in the post-pandemic response in the new normal as well. So with this set of problem statements, we organized this virtual ideation challenge, as you can see here. This is a 2-day event. It took part, we actually organized it over a weekend, okay, 27th and 28th of June, and it comprised of 4 sessions. So we actually had 2 sessions on each day, right? And this was an event that was jointly organized by SUTD and Changi Hospital. So CGH was an instrumental partner because they were the ones working at the front lines with the, they had the experience dealing with COVID, with managing the patients with COVID. So we wanted them to share their experience with us and with our students. So who were the people involved? So we kicked off the event with a virtual webinar, and we had over 100 plus attendees, which was really exciting for us. And of these 100 attendees, about 58 of them were our student participants in the virtual ideation challenge. So they continued on to the other sessions, and they were divided into 14 teams, and each of the 14 teams worked on a different problem statement, okay? And of course, we had our Changi Hospital, our CGH partners. We had a bunch of clinician speakers, as you see here on the bottom left. We had also 21 clinical mentors, which was pretty impressive, trying to get a group of 21 different clinicians who are very busy people, contribute their time on a weekend to speak with our students and to work with them on these problems. And on the SUTD side, there were 3 faculty heavily involved in the ideation challenge, as well as several graduate students who acted as design mentors, who actually just worked closely with the student participants in developing their designs and their deliverables, okay? So we chose to run this as a virtual ideation challenge for a few reasons. Of course, the main one being because of the restrictions, right? Due to COVID-19, we weren't able to have a physical event. However, we also tried to look at this as an opportunity. Okay, so we saw that there were some unique opportunities offered by the use of a virtual platform. Okay, so we started thinking of this as a design problem, right? So how might we leverage on digital tools, okay, and digital learning in order to support our student learning and facilitate innovation, okay, amidst the COVID-19 pandemic? So this is a challenge that we gave ourselves. So in the next slide, I'm just going to introduce 3 opportunities that we identified, okay? And we use digital tools, okay, digital platforms to achieve these 3 things. So William will share with you each one a little bit more, but let me just give you a quick overview. So the first opportunity that we identified is that the digital platform allows us to connect students directly with the clinicians and hospital leaders at the front lines. So what this means is we can have the we could invite clinicians, right, to speak to our students, say in the form of a webinar, or perhaps even to interact with the students on a more personal level in a Zoom breakout room, for example. So this way our students would be able to get the perspectives, okay, with regards to COVID-19 delivery and management and some of the challenges involved. So the second opportunity that we saw is that we could use this platform to promote SUTD's culture of design and co-creation to current SUTD students, as well as to future SUTD students. So we could actually invite early matriculation students, right, to join our existing students to form teams together and basically design together. Okay, so William will talk about this a little bit more as well. And finally, the third opportunity that we saw was that we could actually try to promote real-time collaborative learning with everybody, in different spaces in their own homes. Okay, so these digital platforms will allow us to bring everyone together and work in these small teams in order to come up with their solutions. Okay, so William's going to take you through these 3 points in greater detail. Right, William?
Yes, I'm thankful that I was given the opportunity by Prof. Xiaojun and Prof. Pina to organize this event, and it was really a heartwarming one because we can see all the students are very busy, getting aligned to what we have planned for them, and getting them to on board to discuss, to create, to even to innovate new solutions as to the 14 problem statements that was presented to them. Of course, we won't ask each team to come up with solutions for all 14 problem statements. That would be too much. So I and Prof. Xiao Jian has actually grouped them up into groups so that in fact each of the team have one problem statements to look at. Yeah. So as to the slides that you are looking at now, opportunity number one, as you can see, is about gathering clinician perspective. So getting clinician perspective actually happens during the opening session, where we actually saw the 100 seminar participants, and this also includes the 58 ideation challenge student participants that come together at the online Zoom platform to know about specific COVID-19 healthcare challenges during the pre-ongoing and post-pandemic phases. How did that happen? Because during the sharing by the three leaders from the various healthcare perspective, they actually allow them to emphasize with the situation and allows the students to have a first-hand experience on being a frontliner shoes without having to travel outside to be physically at the location where they are working to understand what exactly happened. So in this esteemed panel of speakers, they were also able to share more through the lens of the regional health services, hospital, and as well as the clinical perspective by the speakers. And yes, during this process, the speakers also have a chance to follow up with a virtual 360 degrees immersive tour of the CGH emergency department, as you can see here. And that is how you are able to get the students connected by having something visual for them. Otherwise, you'll be just me talking and talking and talking, and you will not be able to have that visual image in your mind on what exactly is being done, how did they manage the situation, how do they cope with the increasing number of foreign workers that need to be screened. So with this, it is actually a rare insider view. As you can see, behind the scenes, how the footage of the COVID-19 screening is also presented to the student participants does play a part in getting them to know through videos and then to explanation by the leaders. So opportunity number two, as you already know, this is an ideation challenge. So we can't say we don't get them to know about design innovation. We have to give them something. We have to give them understanding of the 4D framework, which we actually use the UK's Design Council's 4D framework to get the ball rolling. And we were very happy to have Prof. Arlindo to actually deliver a 40 minutes crash course, especially for this program. And you know what? In fact, I was pretty surprised. You know, he did it in 40 minutes, where I have to actually attend a one-term course for my design innovation during my master's program. But it's surprising and surprisingly well received, because the participants after that were able to use the methods that will be that was taught by Prof. Arlindo. And they were able to map out the different types of methods to use at different phases. As we can see here, it involved discover, define, develop, and deliver. So there are 4 sessions, and in this program, the virtual ideation challenge actually corresponds to this 4D framework. And for each session, there is also a different deliverables that the students need to achieve. So in the structured process, right, the student participants get to experience a full picture of a design innovation process. And as you have already seen on the screen, the first D stands for discover. And this is realized through the first activity of the 2 days event, which was the online webinar. And at the discover phase, they actually apply the contextual knowledge from the speakers to later on come up with their ideas when they have their team discussions. So By doing so, it allows them to actually check in with their teammates on whether the problem statements they are given are actually something that they want to solve. Is it something that is relevant to solve? So in other words, with the discover phase, it helps the students to reaffirm their problem statements and identify gaps for improvement. Okay, next, I already talked about discover and define. I shall move on to develop and deliver. So through after the discover and define phase, the students get into teams. They will break out into different groups and they will actually discussing amongst themselves. And that's where they start developing ideas through the design methods that was being taught to them. And they determine the kind of tools they want to use, for example, sketch or user journey mapping. This is where they apply what they learned in this ideation process during the ideation challenge. And with their final solution in mind, they actually come up with the presentation deck, which is for the deliver phase, where they have to pitch their eventual idea to the panel of judges. So opportunity number 3, as you have guessed, most importantly, for a virtual challenge to happen, you would need the digital tools. And this is how we actually look at it in a very systematic manner. For example, we talk about communication. Therefore, we have a Telegram being set up for them so that there is this constant check-in, and also as well as allowing organizers, which is us, to send prompt broadcasting of reminders, announcements, and links. And students actually could reach out to facilitators for assistance at any point during the program. Of course, the next thing is about the group breakout rooms. This is where we have more things discussed amongst the teams, where they actually work out the solutions for their problem statement. With the Zoom breakout room, they have their own safe environment where they can talk amongst themselves, away from all the distraction from other groups, as well as from other things that are happening at the same time. Then, of course, lastly is a Google Drive. We have that shared folder ready for each team, and each team has this Google Drive so that they can refer back to the notes, the slides, and anything that is related to the program, as well as the challenge that they are, in fact, doing. And of course, to get them on pace, right, you have the itinerary mapped out for them so that they know what they need to do at specific times.
Can we round up?
Yes.
Thank you. Yeah, yes. Sorry.
No problem. So as you can see, right, we have the esteemed group of judges. Actually, they are both from the SUTD and the CGH. And we have this winning idea, which is reimagining the mask. And then we call, as the students actually look at redesigning reusable masks for general public, so that it's adjustable and more breathable. So I'll quickly just run through, just to make sure that your eyes land on the right colors. Just look at the purple and the green. So as you can see in the 2-day event, right, the purple and the green does show us that 66% of the participants responded satisfied and very satisfied about this event. So for this, it is about the reflection in terms of knowing the healthcare challenges. As you can see here, there is a 14 times increase in the students, participants who realize that challenges are more about it. They have more knowledge about it after the event. So from 2% to 28%, which is a very good improvement for the students. Okay, so the last part is about grasping the 4D design framework. In this response, you can tell before the event there's a mixed response on level of knowledge of students. At the end, it increased quite significantly, and you can see the jump is already increased up to 76%. Last but not the least, these are just some of the more verbatim reflections from the students. They find that there was good guidance. They have somebody who can ask questions, and the healthcare workers, the clinicians are able to share with them and listen to them. And the interaction with clinical mentors are very insightful, as well as also during the process, we have facilitators who help them in the ideation process.
All right, so let me wrap up real quick. So again, what we did, we extracted out the key feedback from students, and we picked 3 areas in which we could potentially improve if we were to run this again in future. The first being giving students a little bit more time for the ideation process, because they need time to kind of digest what they've just learned from the clinicians and to apply the design process more methodically. Also, perhaps more avenues for real-time feedback from the clinical mentors and from the design mentors. And finally, the teams would actually have liked to hear from each other, because apart from the 5-minute pitch, there was really no cross-sharing between teams. So that's, again, something which they would have liked. Okay, so this is the last slide here, which is we come back to this, our initial goal, right? Like, how might we leverage on digital tools to support learning and facilitate innovation? So here are 3 ingredients for success if we distill everything that we did down into these 3 points. Okay, the first thing which we thought was really important is creating a very conducive virtual environment for discussion. Okay, and 2, we thought that it was essential to have these external platforms to allow for communication between students and the organizers, as well as for the exchange of information. And the third ingredient for success was really taking a very active or proactive approach towards meeting student needs. So we actually planned everything out beforehand, and we made sure that students had many channels of approaching organizers. They had many opportunities to speak with the clinician mentors, and we built that into the ideation challenge. Okay, so my last acknowledgement slide is to thank everybody involved. We could not have done it without a huge team of people from SUTD and Changi Hospital. So William, Bina, and myself, we put together this event, but we have lots of clinician mentors here, Chun Hao, we have Christian, Liang, and the leaders as well from SUTD and Changi Hospital, Dr. Shu Pompo and Prof. Pei Kin Yong. So again, we could not have done it without the help of all these people. So thank you very much.
Okay, thank you, Xiao Qian. And now, because we are running short of time, so we will keep our questions later or put it on the OneNote. Okay, now we